Today, McDonald's, one of the biggest fast food companies, announced that starting in 2017, they will only buy chicken that's been raised without antibiotics that are used for human medicine. That's a huge public health win. This is a big deal because of the problem of antibiotic resistance. Every time we use antibiotics, we can potentially end up with antibiotic resistance. And we raise 9 billion chickens every year in this country and use antibiotics on a lot of them. So if McDonald's, which is a big purchaser of chickens, is saying that their portion is not going to use antibiotics anymore, that means that there's fewer chances for antibiotic resistance to occur. That means that the antibiotics are much more likely to work when we need them. Pew has actually been working with a lot of food producers and the companies that buy meat and even the drug companies that supply the antibiotics for the producers to see if we can come to some way to decrease the overuse of antibiotics that are used for food animals. Well, there's really 3 steps that I think need to happen now. First of all, the competitors need to be looking at what McDonald's is doing and saying, we can do this as well, and we will do this. And the second thing is that the producers need to give more data, make more data available. That makes it better for the producers because then they can make better choices and make the best decisions for their animals. And it also is good for public health because it means it will be using the least amount of antibiotics to make the most difference. And that's a win for public health. And then the third step is that right now McDonald's made this announcement on chicken. But if you think of McDonald's, you think of other meats. And so beef and pork would be the next logical steps to look at. Can we do the same thing with beef and pork that is being done with chicken? I think we can.